This is Jefferson Close-Up, and I'm Carol Saline. My guest today is Dr. Linda Bogar. How nice to have you here.
Thank you.
Now, there was a time in your life that you had no interest whatsoever in being a doctor, and you dreamed of being in musical theater. So what happened?
Well, I've continued that dream, actually. I continue to do musical theater and community theater, and I take tap lessons as well.
Well, were there teachers that influenced you? I mean, what that tap dancing studio dream went out the window at what point?
Well, it was about high school, 10th grade, when teachers started to ask me what I wanted to do, and they didn't necessarily agree with my response, and so they kind of encouraged me to think outside the box and think of some other things. And so with their advice, I went and volunteered at a hospital in our area in Pittsburgh, and they let me in the operating room taking patients back and forth, and that's where I got interested in becoming a physician.
And how about heart surgery? What steered you into that?
When I was a general surgery resident at Temple, we get to sample the different subspecialties, and I got to do a period of time in cardiac surgery, and the heart surgeon there was very enthusiastic and helped guide me and suggest that this might be something I'd be interested in.
And do you still take tap lessons?
I do.
Oh my gracious. So what are some words that might describe you besides quick on your feet?
Well, I like to consider myself caring. I really care deeply for my patients, and I think that comes across and people appreciate that. I think I'm also very dependable. If you ask me to do something, I usually follow through. I mark it on my calendar. I make sure I make the time to do it.
So you're a tap dancer, you're a doctor, and I believe you're also a mother.
Correct.
How do you manage all that?
It is difficult. It's a challenging lifestyle, but having my son really brought focus and clarity to my life and really gave me an outlet for emotions and feelings that I didn't have before, and it's really enhanced my life.
And do you get much help from your husband?
I do, except he's away a lot. He's in the military, but when he's around, he spends a lot of time with Dylan.
Oh, nice, nice. So there are only about 100 female cardiac surgeons in the entire country, which is pretty darn rare. Why did you want to join that particular club?
Well, you know, I like to think of myself as a doctor or a surgeon, not as a female surgeon. And when I saw heart surgery, I decided that I really like the anatomy of the heart. I like the excitement of knowing immediately that you're helping the patient. You can see immediate results.
You come together with patients at a very critical time in their lives. Heart surgery is a big deal. How do you, in particular, try to connect with your patients?
Well, I think it's most important just to let them know that you care about them. That's, in the end, that's really what patients want to know. They don't care where you've trained, how much time you spent, or how many papers you've published. If you really show them that you care about them and are there to answer any questions and explain things to them in ways that they can understand.
So you gotta have heart.
That's right.
Thanks very much for coming in.
Thank you.